When I was 38, I was on my 10th mammogram, and I was told that there was a lump, and I went back and I had an ultrasound, and they immediately saw that it was a tumor. Then I started the entire process of talking about getting a double mastectomy and whether or not I would need chemo and radiation. I received all of my cancer treatments through another hospital, but after research, I chose to seek out different options for my reconstruction, and I was happiest at Nebraska Medicine. I felt like someone was finally listening to me, and I felt like I was given more options than just getting a double mastectomy and implants and moving on, because that's not what I wanted. I wanted to be as close to normal as possible, and that's what we deserve as cancer patients, in my opinion. We've been through so much.
In general, there are two pathways that a woman can choose if she decides to have breast reconstruction. One is implant-based, using either tissue expanders or permanent implants, versus using their own tissue. The typical donor site for tissue used for breast reconstruction is the abdomen.
Once you've done radiation, your skin is compromised, period. And when I went to go get my breasts to the size that I wanted them to be, because the original ones were just way too big for my body type and I wasn't happy, I was told about this DIEP flap procedure, and it blew my mind that we could even do it. It kind of is crazy in itself that it's even possible. He takes some of my stomach area and moves it up and makes breasts out of it. And it's amazing, and they're mine, and it's exactly what they feel like.
In my opinion, for the correct patient, using their own tissue is the gold standard. It has the capacity to gain weight, lose weight, it ages well with the patient. In general, the quality of the result improves with time, and it's much more tolerant of problems related to radiation therapy, which is becoming more and more common for breast cancer patients.
Some patients don't like the idea of having an implant or a silicone implant in. They want something that's a little bit more, realistic in terms of texture, in terms of look. Obviously, with an implant, we can't get a natural-looking breast.
On the second implant, I unfortunately got an infection in my left side. Once I got that infection, I knew, and Dr. Fletcher and I had talked about it, that no doctor was going to let me have implants again. And I'm 41 years old, and I did not want to not have breasts. Even after my infection, I had to have one breast and no breast, and that was not fun at all. So when I came to, I knew that this was the best option for me, and Dr. Fletcher and his team guided me to that, and it was amazing, and it was the best decision I ever made. They're just soft, and they move, and I can sleep on my stomach if I want to. I can play golf again, which is really exciting, and they just feel so natural. And of all the things that we have to go through as women, specifically breast cancer survivors, breast cancer patients, all of that, it is so nice to feel normal again. Like, it's taken a long time.
In general, patients are very satisfied with the process, and once they get through the initial weeks of recovery, most people feel very, very confident in their decision.
For patients that are seeking, abdominally based tissue with maybe less morbidity in terms of donor site, meaning we actually leave most of the muscle behind and a lot of times don't even take any muscle. It's a very good option, and one that's not being offered globally around the state.
My double mastectomies, multiple surgeries, infection, and honestly, this was a cakewalk compared to all that. I am excited to see my kids grow up, which even 3 years ago we weren't 100% sure. We were pretty confident, but every surgery I went into, every treatment that I had, it was scary. And my husband and I are young. We have 3 young kids. So I'm just excited to put all this behind me, to have a normal life again, and to do all the things that moms are supposed to do with their kids.